Great to have you with us here on WPR News. Larry Mealer here, and today we take a look at your pet's health to begin the show, and Dr. Bill Stork back with us. He is the owner of Lake Mills Veterinary Clinic, also an author of several books, and it's great to have him back. We'll hear Dr. Stork's advice on what to do if your dog gets sick, and as we talk with him, want to hear from you, of course. Let us know how you care for your dog when it gets sick, for example. Or maybe you want to know how to tell if your dog is just feeling under the weather. Number to call, 800-642-1234. Or you could send an email to talk@wpr.org. Dr. Bill Stork, welcome back. Good to have you with us.
Well, good morning, Larry. Glad to be here. And it sounds as if you might need a neti pot yourself.
Yeah, I don't think I have a cold, but I have a little congestion this morning for some reason. I don't know why. Would I give that to a dog, by the way, if I had a cold?
No, probably not. But the same set of circumstances, time of year, lots of people, lots of pets. In smaller spaces, sharing air spaces, make it more likely for those things to be passed around.
Yeah. What are the most common infections that you're seeing at the clinic this time of year?
It's pretty repeatable and somewhat predictable. After the holidays, you can pretty much sit back, wait for a couple of days, and the phone will start to ring, especially with owners of dogs with kennel cough. And if we were on TV, I would make air quotes of kennel cough because actually it's more a group of infectious respiratory diseases. The nerds would call it canine infectious respiratory disease complex. And it's not as if these dogs are going to kennels and going to groomers and being boarded and being exposed to any sort of novel organisms, because these are the organisms that are in the environment all the time, but some combination of the stress of being away, maybe an extra exposure to a dog that's clinical at the time. And the next thing you know, you have a dog that's coughing, runny eyes, runny nose, maybe even feeling a little bit lethargic. So kennel cough is easily the most common thing that we find this time of year.
Yeah. So if your dog is feeling lethargic, if it's sneezing, I mean, how do you know if it's something you got to come and see you about or a vet?
Well, that's a perfect opportunity for a rewind. And I'll answer that question by first of all saying that I really don't want people to be nervous about kenneling their dog, about taking their dog to canine sports zones or to classes or any opportunity to socialize them, because the ramifications of not keeping your dog active and not keeping your dog socialized are much greater than any possible infection that they might acquire out there. And when that phone rings, my dog is coughing, and actually the phone rang and there was a message on my computer right before the show started. If that dog is still bright, alert, and responsive, BAR, eating and drinking and coughing infrequently, that's the dog that we would really prefer not to medicate. If the cough is at the point where the dog is having a hard time sleeping, or as a result of the dog coughing, the people are having a hard time sleeping, we don't want the kids falling asleep in second grade because the dog's coughing all night, then that's a great opportunity to potentially use some cough medication, but not necessarily antibiotics. If the cough is persistent, if the dog is lethargic, not responding to its normal cues with the vigor that it normally does, maybe the appetite is a little bit decreased, maybe a little bit less active on walks, and then is when we reach for the antibiotics. And just like people, one of the reasons why we don't like to reach for antibiotics is because these are always a mixed group of organisms that infects these dogs, and there's always viruses, there's always bacteria, and we prefer to get through it without antibiotics if we can.
Yeah, makes a lot of sense. What about over-the-counter medications? You're worried about a cough or something?
Well, in the wake of Thanksgiving, we ran the Lake Mills Walgreens out of Robitussin DM. Um, DM for dog medicine, you might think it's dextromethorphan, but it's actually DM for dog medicine. And that's the one that doesn't have any of the acetaminophen and everything else. And if you are in a setting, and there's plenty of settings where you can't speak with a veterinarian after hours, if you're up north, that's a really good tool to have around. And the dosage, for a dog is the dosage for a kid. And you can use Robitussin DM up to every 4 to 6 hours to settle that cough down. And we're not trying to make the dog not cough, because a cough is this beautiful piece of physiology that helps us expel infectious organisms. But if it is obstructive, that's when we need to mute it as best we can.
Yeah. Let's turn to sneezes for a minute. Casey emailed us, as an indoor cat about 10 years old. Been sneezing a lot lately, a bunch of sneezes, maybe 4 to 8 per time. Plus, he's sleeping more than these past few days, and his ears were feeling cool to the touch. He probably got a cold last week, and how cold it's been. Do you think this is a reasonable deductive thought? Any advice on how to keep him, how to heal him or make him feel better at least?
Well, it's a good deductive thought, so long as we realize a cold is a big, broad description of a group of symptoms that could be caused by a whole lot of different things. And when Casey's cat is sneezing, then the things that we ask are, what is the nature of the sneeze? What is the expectorant look like? And when people say, well, they don't produce anything, that means that it's clear. And like if he can take his glasses and put in front of the cat when it sneezes, that would allow him to be able to tell if there's any off color to what the cat is sneezing. If it is off color, just like in kids or people, that's indicative of an infection. Other things to be looking at with regard to a 10-year-old cat that started to sneeze more frequently is their resting respiratory rate, when they are doing nothing. And we would prefer that resting respiratory rate to be well below or in the vicinity of 30 or fewer respirations per minute. Appetite, he mentioned that the cat was being a little bit lethargic as well. So when a 10-year-old cat develops a sneeze and is a little bit lethargic, and I'll even make an assumption that the cat's largely inside, that gets our attention. And if that is to persist for any period of time, that could warrant a veterinary visit.
Yeah, makes sense. Vivian in Green Bay has a question. Hi, Vivian.
Hello. Hello. I've had cats for 7 decades, 25 or so. Years ago, dentals were uncommon, and now I consider them necessary, and I have 3 cats. But I had heard that dentals contribute to deafness, and I wonder if there's any information about that.
Dentals contribute to deafness. Boy, that just should not be the case if they are done cautiously and carefully, because as you have noticed, profound dental disease can lead to a whole host of problems, ranging from heart murmurs to tooth root abscesses to sinus infections. As you have noticed, we have indeed, we, as in the veterinary community and pet owners, have started to focus more on ongoing dental health. And what we really love to do is get ahead of it like any other health condition. And the healthier and stronger the patient that we do that dental, extract those diseased and abscessed teeth, the longer that and stronger that cat will live.
Vivian, thank you very much for calling. Appreciate your call. Chase in Madison will give you a chance. Hi, Chase.
Hey, how's it going?
Good. Appreciate the call. What's on your mind?
I have a husky who is about 5.5 years old, and for the last quarter of a year, he's been dealing with pretty low appetite and kind of endless diarrhea. At first, they suspected it might have been Addison's disease, but he fell outside of the range for those markers. And so now it's looking likely that it could be some GI tract lymphoma. They prescribed an antibiotic for diarrhea. I guess my question is, and they recently took him off it, what sort of treatments would be advised for that, and why would they prescribe an antibiotic if he's not dealing with any bacterial infection in his GI tract, especially when the side effects can worsen the diarrhea?
Well, the reason is, and obviously I'm going to have to make a little bit of extrapolation and be cautious here, because if they have tested your 5.5-year-old husky for Addison's, that means that they've done a CBC and they've done a chemistry panel, and there are some indications in there that will lead us to do the testing for Addison's disease. And what they're doing is they're marching through the differential diagnoses for a dog with diarrhea. The reason why they use the antibiotics, the metronidazole, I would bet, is one of the most common causes for dogs to have diarrhea is, this is a great opportunity to use a great veterinary term, intestinal dysbiosis. It used to be called SIBO, small intestinal bacterial overgrowth, but essentially the GI flora are out of whack. And the reason why your veterinarian put him on metronidazole is because often they get better on metronidazole. And we don't often exactly know why, but we as veterinarians are always weighing risks versus benefit, and very, very frequently empirical treatment with metronidazole, and these dogs get better. In addition to the absolute diagnostics for intestinal lymphosarcoma, we can oftentimes suspect intestinal lymphosarcoma when we've ruled everything else out and when the dog has not responded to all reasonable treatment. The absolute diagnosis of intestinal lymphosarcoma is to go in and do surgery and take biopsies from several different places along the gastrointestinal tract. And that's a pretty heavy-handed, invasive diagnostic. And most of us will try and not go quite to that extent.
Yeah. There you go, Chase. Thank you so much for calling. Appreciate your call. Dr. Bill Stork, our guest, owner and operator of the Lake Mills Veterinary Clinic. I'm Larry Mealer for WPR News. Looking at your pet's health today with Dr. Bill Stork, owner and operator of Lake Mills Veterinary Clinic. Just to mention, after 12:30 today, we'll talk about caring for rabbits, hedgehogs, and ferrets with a vet from Cambridge, Wisconsin, who takes a special interest in exotic mammals and birds. Right now, talking mostly dogs and cats here with Dr. Bill Stork. And again, you can join us at 800-642-1234 or email to talk@wpr.org. Dr. Bill, if you have multiple dogs and one of them gets sick with a cold, let's say, how is there any way to prevent the other pets from getting the cold too?
Brace for impact. If your fifth grader comes home with a cold and a cough, then there's a really good chance that it's going to go through the household, but oftentimes someone will be spared. It's the way we build our immune system. So it's likely going to happen short of shower in, shower out, and complete separation of the dogs, which is often not practical.
It's certainly not. I get a cold. It might last sometimes 3 days, sometimes a week. Haven't had one for quite a while, actually. But is that about the same for a dog or a cat?
Most of the time, and you touched on about 3 hours worth of conversation that I'll try and compress to just a few minutes, but it's worthy of note that the enormous majority of the time when dogs get kennel cough, it will last for 5 days to 7 days. There are times when it'll last up to 2 weeks, and in rare occasions, it will last for 3 to 4 weeks. That cough will linger. With regard to cats, and Larry's a cat guy, and lots of people are, when we are presented with a cat with a respiratory issue, I've developed a practice that I always warn the owner that there's a possibility that cat could be what we call a chronic schnorkeler. And a chronic schnorkeler is a highly medical term which describes a cat with a chronic respiratory issue that, you can go to the University of Wisconsin, money's no issue, break the bank, do every conceivable test, every conceivable treatment, and the cat coughs and blows snot for its entire life.
Oh my gosh. Well, by the way, somebody wondered how dangerous kennel cough is.
Well, kennel cough, and we're going to circle back and use the medical term canine infectious respiratory disease complex. In a young, healthy, immunocompetent dog, it's really not anything to be afraid of or alter your life for. I would not change anything about what I do with my dog because of kennel cough. Most of them recover very quickly. There are situations where kennel cough becomes something like canine influenza, which still shouldn't be too bad of a problem unless you have a dog that is immunocompromised, a dog that is aged, a dog that's on a poor plane of nutrition. So the enormous majority of the time, those dogs climb out of it and do just fine.
We have callers online with questions. Sidra in Madison will give you a chance to join in. Hi, thank you for calling.
Hi, thanks for having me. I just have a question about hairballs with cats. I have a cat that, coughs them up a decent amount, and I was wondering if you have any recommendations for him.
Oh, sure. Lots of different approaches to that. There's food out there that will bill itself as hairball remedy, and it will have some sort of a lubricant and a laxative in there that can genuinely be of help. According to Dr. Google, pumpkin is effective with any malady that could affect your dog or cat's gastrointestinal tract. But this is actually a thing that pumpkin, if your cat likes it, can be effective because pumpkin is fiber, pumpkin is a laxative, pumpkin can help escort things through there. Over the counter, there's things like Laxatone, and that is physically like an oily laxative lubricant that will help move things through. One of the other common sense approaches that can make a very big difference is keeping your cats brushed out and groomed. So if you brush out the substrate that they build the hairballs on, you'll cut down on the frequency of the hairballs. There are also treats that can be very effective. So the key is to avoid what is human nature, and that is, well, my cat got better, so I stopped doing the treatment. So if it is getting better and you're giving the treats, the food, the laxative, the pumpkin, keep doing it, and the cat will probably hack up fewer hairballs, but they're obligated to hack up a few on occasion.
Okay. Sidra, thank you for calling. Tricia in Menominee, it's your turn. Hi, thank you for calling.
Hi there. I guess he's about 13-year-old cat who was diagnosed with diabetes about a year ago. And then he went into remission a couple months later, and then, then ended up being diagnosed again with diabetes. And we did some serious dietary changes as well as insulin. And now it's been about a year that he's been in remission. And I think my overall question is just based on your experience, how, I don't want to be too optimistic, but I'm just sort of curious, how long can a cat stay in remission?
In my experience, diabetic cats have turned out any conceivable way possible. And there are, I think the statistics are somewhere in the vicinity of 13 to 15% of diabetic cats will go into remission. And just as you have discovered, they can dance in and out of remission. Diabetes is a really complicated metabolic disease, and especially if you are treating a low carbohydrate diet, they very well may stay in remission for a good long time. You have reason to be hopeful, but if you're in doubt, then a very reasonable approach is to ask your veterinarian to show you how to measure your cat's blood glucose at home and when to measure your cat's blood glucose at home, because, if in doubt, put some numbers on it. And, we can usually tell when they're diabetic because they drink more water and they make more frequent visits to the litter box, and you can tell by the much larger urinary output, but not always. And if you have multiple cats in the household, that gets more difficult to check, but it's not difficult to measure blood glucose at home.
All right. Tricia, thank you very much for calling. Appreciate your call. Canine para-influenza is different from dog flu. I think I understand it that way.
It is, and it's one of the viruses that is also in the quote-unquote distemper vaccine that dogs get. And it's also one of the viruses when we talk about canine infectious disease or canine infectious respiratory disease complex. In that complex, para-influenza virus is one of those viruses.
Okay, and so those shots, do they eliminate the problem, or?
Well, just like any other vaccine, in a perfect world, we would prevent them from ever getting sick as a result of that virus. In the real world, what we find is many fewer of them get sick as a result of that virus. And when they do, the symptoms have a tendency to be dramatically less.
All right.
And yes, para-influenza virus is different than canine influenza. And while we're talking canine influenza, that one is what we call a lifestyle-based vaccine. It's not part of what most of us use in our core vaccines. And the dogs that we think about giving the canine influenza virus to are ones that are going to go to dog shows, to rally classes, that are going to be going to, strangely enough, the Fox Valley area up until the Appleton and Green Bay area, Chicago, Milwaukee, even Madison. If they're going to be going to daycare frequently, then those are the dogs that we think about given the canine influenza vaccine to.
Oh, that's where the chances are higher.
Yep, absolutely. Much greater exposure.
Okay. Jim in Nacita has a question for you. Hi, Jim.
Hey, good morning. I just have a question. I have a 7-year-old lab shepherd mix. Really good dog, very healthy. goes to the vet on a regular basis, and I noticed just right around the beginning of December, he was starting to. He's 7. He'll be 7. He just started getting a small lump, about almond size, maybe a little bit larger on his left side, or I like to say his driver's side, and it's not stationary. It's movable, and I've been hearing a lot of stuff from other people, and of course, the internet about mushrooms or some sort of supplements or something that can go to his food that would help alleviate these. Or is it something I need to be concerned with?
Well, it's something that you need to be aware of. And 7 years old is old enough that we have to pay attention to lumps. And you made a lot of really valuable observations with regard to that lump, that you can get your fingers around it and it's freely movable and it's smooth. And he's a lab shepherd mix. There's an excellent possibility that is a good old-fashioned lipoma, which is an obligatory rite of passage for dogs as they age. And it's a bit of a reach to think that any of these supplements might reduce those, but open mind, I certainly can't imagine that they would do any harm. But about 10% of the time, we will find lumps that seem benign, that seem like a good old-fashioned lipoma, that turn out to be something like a mast cell tumor. And a mast cell tumor is on the list of things that we find with enough frequency to make it worth sticking a needle in that thing, pulling out some cells, putting them on a slide, and just confirming that it is as benign as we suspect it is.
Yeah, so worth getting to the vet maybe and having that done.
Not an emergency, but well worth your time.
Yeah, okay. Jim, good luck. Thank you for calling. Denisha in Madison, your turn. Hi, Denisha.
Yeah, hello. I have a question. I have 15 years old cat who is very healthy. He's red color, long hair. He's running up to trees and listening, and a very good cat. But he never want to eat something like canned food or our food, only dry food, all his life. And because he's a little bit more dry, then I think that it has to be, is this cat missing something? Because he's 15, but I can say he's never changing his health. He never had problem. It means this is my question, 15 years old.
What do you feed him, by the way?
Science diet.
Okay.
Yeah, a good diet. And I will tell you that I think that's a really good sign that he's persistent about eating his dry food. And let the record show that changing the trajectory of a cat is not the easiest thing in the world to do. And it's not unusual for cats that have spent their entire life eating kibble, that when you present them with canned food or tuna or moist foods that we think should be enticing to them, that we think should get them more moisture in their diet, and they just turn up their nose and walk the other direction. So hopefully that means that his teeth are also in pretty good shape. It sounds like his mobility is excellent, and that is fantastic. Yeah. So, there's 100 old metaphors out there about not being able to lead a horse. You can lead a horse to water, but you can't make him drink, and you can give a cat canned food, but you can't make him eat it.
I've learned that, believe me, with my two cats. Denisha, there you go. Sounds like you're in pretty good shape. Tara in Colfax, Illinois, we'll go to you. Hi, Tara.
Hi, Larry. Hey, I have an 11-year-old Labrador dog that has been coughing for about 2 years. The vet thinks she has a collapsed trachea. She's been on antibiotics and cough medicine, and it doesn't work. Is there anything that can be done? Are there any cures for a collapsed trachea?
Couple questions. First of all, how big is your 11-year-old dog?
She's Labrador. She's about 95 pounds.
Big dude. Okay.
Yeah.
And under what circumstances does this cough take place? Is it when we're particularly active or when we're
Nope.
particularly?
Not at all. Middle of the night, random. In fact, even when we go, she is active. We walk daily,
Okay.
and yeah, no, it's quite frequently, and it almost sounds like she's choking and going to throw up, but she never throws up. It's not really like a cough. I guess it's more like like she's going to throw up, but she never does.
Okay. And I assume radiographs have been taken?
No, they haven't actually.
Okay.
No.
That would be the first next step is, if in doubt, we start doing some diagnostics and asking some questions and see if we can't get some answers that way.
Yeah.
X-rays would be the next step.
All right. There you go, Tara. Thank you. Pam in Marshall, it's your turn. Hi, Pam.
Hi. My son adopted a dog 3 years ago. He rescued her, and she was 3 months old. And she still starts shaking anytime she hears a noise, like even coffee grinder, dryer, washer, anything like that. And he's very gentle with her, and he's very patient. But do you think this would ever go away, or is it possible this may last her whole life?
Well, he's got himself a wee bit of a challenge there for certain, and it sounds as if your son is taking a very common sense approach. But there's a lot of intricacies in there that would be hard to work our way through without actually watching these things happen, because there's a possibility that when this happens, your son is actually reinforcing the dog being nervous. For example, when the coffee grinder goes off and the dog trembles, if your son goes to the dog, then he could be rewarding that behavior. And believe me, that's not any sort of a criticism with regard to your son. The short answer is the way to work with those situations is by way of counter conditioning. And the premise of counter conditioning is to keep the dog outside or into its comfort zone, but on the edge of its comfort zone. So, and just painting with a broad brush here, for example, if it is indeed the coffee grinder, then find how far away from that coffee grinder the dog needs to be in order to not get nervous or not get terribly nervous. And then have a second person push the button on the coffee grinder and reward the dog, and that exercise is over. And you can see these things take a lot of reps and a lot of persistence and a whole big bunch of patience. And hopefully the coffee grinder translates to the doorbell, translates to, the car starting or other triggers that make the dog nervous. But it's tough. Get yourself a certified behaviorist who very well may be able to help with that.
Yeah, that's a good suggestion. Pam, thank you very much for calling. You can join in too. Number to call, 800-642-1234. We'll get you on pretty quickly. Or you could email to talk@wpr.org. Listener called, couldn't stay with us, but wondered if you could talk more about congestive heart failure in dogs, the symptoms, diagnosis, treatments, if any.
Well, that would actually be exactly why I recommended that Tara down in Colfax, Illinois, takes her dog to get x-rays, because congestive heart failure is a pretty common finding in aging dogs. There's actually groups of breeds where it's a little bit more predominant. Like your King Charles Cavalier Spaniels, it's fairly common. Cocker Spaniels, it's fairly common. And the symptoms that you will recognize could be a slightly rapid resting respiratory rate, exercise intolerance, or the big one is a cough that takes place more when the dog is at rest, because when we're at rest, We don't respirate, we don't ventilate, we don't circulate nearly as well as we do when we are up and we are active. And the congestive heart failure is the extension of a heart murmur. A heart murmur is an abnormal heart sound in between the heartbeats, and it is as a result of blood leaking backwards in the heart and eventually pooling in the lungs, and we get fluid in the lungs is kind of the short answer, and that's what leads to the cough associated with congestive heart failure, congestive heart disease. The good news is it's also a condition that we can usually pretty successfully manage.
Excellent. All right. Judy in Waukegan, Illinois emailed Judy had a beagle who developed kennel cough as soon as they brought him home from the breeder, the real viral kind, which developed within 2 weeks into high fever and double pneumonia. He's the only dog Jody's ever known who had to be kept in an oxygen tent for 3 days and monitored 24/7. So Jody just wanted to toss in that to folks, if your dog doesn't improve, you ought to get him to a doctor.
No, absolutely. And those are the cases that are out there in the periphery. We don't see those very often, but clearly they're on the list of things that can happen.
Shannon in Wisconsin Rapids, we'll go to you. Thank you for calling.
Hi there. I'm calling because we have a Rottweiler Mastiff mix who has very floppy ears, and she seems to be very prone to ear infections. We've seen a vet for treatment when this gets pretty bad, but I was wondering if there's any advice on how to be a little more preemptive with keeping these ear infections at bay.
Yeah, we develop, obviously that's individual to the patient, and the answers are very frequent cleaning, and we search for the frequency required to prevent the infection from setting in. And that's going to be different for every single solitary dog. The worst ear infection that I ever saw, the most persistent ear infection that I ever saw, actually belonged to a German Shepherd named Mike that belonged to a Vietnam veteran also named Mike. And that dog had the most erect, largest ears that I've ever seen on a dog. But that dog did not read the book about floppy ears and had an ear infection very, very persistently. That dog, we had to clean its ears 2-3 times a week. Sometimes even when repeated cleanings aren't enough to keep things at bay, then we'll resort to what we call pulse therapy. And what pulse therapy is we'll pick, for example, 10 days at the beginning of every month or 10 days at the beginning every couple of months and treat it to keep things at bay. That's not our favorite way of doing business. There are also times, and it's worthy of pointing out, that sometimes ears are ears and sometimes ears are an extension of the skin, because the skin is the biggest organ in the body. And if the dog also has skin issues, they can extend into the ears as well. So lots of nuance there. And if it's a deeper ear infection, sometimes, not often, but sometimes we will put those dogs under general anesthesia and get all the way to the eardrum to clean those ears out. With it, when it's really, really persistent, sometimes general anesthesia and exam and deep cleaning can be the ticket.
Shannon, there you go. Thank you so much for calling. What's the, is the solution that you use the same for any dog, Dr. Bill?
We always want to not be irritating. When people say, yeah, I use dilute hydrogen peroxide, we beg them not to. Oftentimes, we want people to use things that are mild, things that are not oily. Please, no essential oils or anything to that effect, and things that have an astringent property to them, like propylene glycol, that will help dry the ears out. Lots of them will have ingredients in there that will break up the wax and the crud in the bottom of the ears. Some of them will have like ketoconazole in them, which is an antifungal, because people ask, why does my dog keep having ear infections? My response is, why don't they? I can't imagine a more perfect place to grow things than an ear.
Yeah.
It's warm, it's moist, it's a dead end. There's sloughing cells, there's blood, there's all kinds of substrate to grow things. So not uncommon.
Dr. Bill Stork, owner and operator of the Lake Mills Veterinary Clinic, our guest. I'm Larry Mealer for WPR News. Tomorrow on the show, we hear the story of 4 women physicists who escaped Nazi Germany during World War II. We'll also take a look at a new travel guide. That's tomorrow on the show. Right now, looking at your pet's health with Dr. Bill Stork of the Lake Mills Veterinary Clinic. And lots of callers online. It was one question, just back to colds again. Somebody's wondering, can you catch a cold that your dog has or the other way around?
Probably not.
Okay, there we go. Jenny and Madison, your turn. Thank you for calling, Jenny.
I have a 13-year-old approximately. She's a rescue Beagle Basset mix. She has a heart murmur, but it's not giving her any problems. As a matter of fact, the last time she was due for either an echo or a x-rays, she was doing so well that vet didn't even recommend that she have either or. We did start her on 5 milligrams of pimobentin. She's happy, she's energetic, she walks every day, she eats. Her reps every morning before we get out of bed are 12, 13, in that range, never much over 13 or 14. My question is, I take her once every 5 or 6 weeks to be bathed at a facility that is a dog care. They have dogs come in and spend the day there. And apparently they had some dog that had a kennel cough. And, my dog has been vaccinated for kennel cough. And I take her early in the morning so that she is not with any other dogs. She's not kennelled. They bathe her, and then I wait for her and take her home. Is it okay to continue to take her there if there's kennel cough?
Yeah, I think the risk is fairly minimal, not because of the risk of exposure is minimal, but because you're doing so many things so well. And first of all, a 13-year-old approximately Beagle Basset with a heart murmur that you are walking every day and preemptively giving the pimobentin, then you have your bases covered, and that is absolutely positively awesome. And speaking for myself, I wouldn't hesitate to deprive my dog the spa day just because of the heart murmur and the potential exposure to kennel cough.
Yeah, that makes sense. Jenny, thank you for calling. Gerard in Marshall, your turn. Hi, Gerard.
Hey, how are you doing?
Good.
Hey, we have a bunch of Great Danes. We have 4 adults and 4 puppies, and we had 5. I'm calling you about Duke. He was 5 years and 3 months old, and he seemed fine. The only issue he had was he had a hot spot that he kept licking and licking and licking for 3 years. But one day we walked out into the kennel, and he was laying there dead. And he had blood coming out of his nose, and our vet said that he probably had a heart attack. Does that sound about right?
Well, kind of like kennel cough and kind of like a cold, a heart attack is a big, wide, overarching description of a whole group of potential etiologies. And in a person, when we talk about them having a heart attack, usually what that means is that one of our greater coronary arteries has been obstructed and deprived the heart of blood flow. Not likely that. In a 5-year-old Great Dane, that died acutely and had blood coming out of its nostrils. A really common finding in those dogs that could also fall under the category of a heart attack is a heart tumor. Dogs are famous for cardiac hemangiosarcomas, big vascular tumors that can grow on the heart. And those dogs can be absolutely 100% normal right up until they pass suddenly. And when they pass suddenly, it is because that really vascular tumor has bled out. And that's just one of the things on the list of possibilities that could have resulted in the untimely and sad demise of your dog. But yeah, that hopefully that fleshes it out just a little bit.
Yeah. Gerard, thank you for calling. Sorry that you lost your dog. Shane in La Crosse, your turn. Hi, Shane.
Hey, I have a 3-year-old black lab that from the beginning he's always had like digestive issues. He has pudding poop. We've tried Pro One, Purina. We've tried Jinx. And recently with trying the Jinx dog food, he is, with pumpkin in it, he's now starting to eat his own poop. It has horrible gas. And it doesn't matter what food we seem to try it doesn't seem to take care of the poop issue or now new issue.
Yeah.
Okay, and that's always one of our favorite conversations in veterinary medicine. My dog is eating his own poop. But ahead of all of that is a lot of really frustrating time with those loose stools. I assume that your 3-year-old lab is otherwise physically really strong, good body condition, good endurance. Everything else about the dog is in good shape. Is that correct?
Oh yeah, he's great. He's almost 90 pounds, shiny coat.
Okay.
Just great shape.
Okay. And I also assume that your veterinarian, there's a whole litany of tests that we do, CBC chemistry panel, those usually turn out to be normal. And then there's a test out there called a GI panel that your dog would have had to have been fasted for 12 hours before they drew the blood. Was that test done by any chance?
No, we just had them at a checkup, and they never said to do that or asked to do that. They took a stool sample for like parasites and stuff like that. They said that was all normal, but nothing fasting.
Okay. Well, this is one of those cases where it's a lot easier to be on the radio, on the telephone, than it is the vet that's in the trenches trying to solve these problems, because these issues can be elusive and they can be challenging. And whatever you do, don't tell your vet that, hey, that guy on the radio said, why aren't you doing a GI panel, or why aren't you doing a fecal PCR? But the guy on the radio says there is a more detailed, more sensitive fecal test that is a referral test that costs quite a bit of extra money, but in these persistent cases can give us some answers. And when you're talking about, perchance, are these stools like an obnoxiously large volume stools like cow flop feces?
No, he'll start out solid, and have like 3 solid ones, and then it goes to the loose stool afterwards.
Sure, yeah, and that's probably why your veterinarian has not gone to the extent of doing the any of these more detailed tests. But it really sounds like you're heading in the right direction. Just keep asking questions.
Yeah. Well, there you go, Shane. Thank you so much. Dr. Bill Stork, our guest, he'll be with us right up until 12:30. We'll take a look at the news, and we'll be back. I'm Larry Mealer. Great to have you along today on WPR News. Larry Mealer here talking your pet's health with Dr. Bill Stork, owner and operator of the Lake Mills Veterinary Clinic. He works with both small and large animals. And great to have him back to answer questions about your pet's health. Join in. You can email us to talk@wpr.org or give a call to 800-642-1234. Perry in Oconto has a question for you, Dr. Bill. Let's go there. Hi, Perry.
Hello, and thank you, Dr. Bill, for the service you provide to us. So thank you very much. I have a two-part question. One is first on HeartGuard and the preventative for that. I saw an article that was saying things about ophthalmologists in the veterinary world had some concerns about low-dose ivermectin, and Interceptor Plus did not use that type of drug to treat the heartworm. And so my question was, do you use Interceptor Plus, or have you heard of anything about the retinal damage that can be done by ivermectin? And the second question is, now this doesn't concern me too much, but I saw that Credelio had a very good efficacy on the Lone Star tick, which doesn't concern me, but I was wondering if the efficacy was tested on the deer tick, and I've currently used NexGard, but that was terrible on the Lone Star tick.
Well, first of all, Terry, you've given me a homework assignment because I will have to go out on our database and search for those studies that suggest that low-dose ivermectin could potentially cause retinal damage, because if that's the case, I'm not aware of it, but we absolutely use Interceptor as well. We'll use Interceptor on lots of our shepherd type dogs, or anybody that might have that MDR1 mutation, in which case my answer is that if you have any sort of hesitation and there is an equally effective option, then we use the equally effective option. And the answer with regard to the Credelio is, yeah, it's just good. Credelio is really quick to kill the Lone Star tick. And, you know, the Texans are making their way north, ticks and all. And we've actually seen the Lone Star tick as far north and as far east as New Hampshire and Connecticut. And we don't think that the Lone Star tick is capable of transmitting Lyme disease, but there's a really reliable statistic out there that 25% of our ticks are Lyme positive, because in the environment, half of our ticks are deer ticks and half of those deer ticks are Lyme positive. And for those who are resting comfortably looking at the calendar that it's January, it's going to be in the 40s this week, if not in the 50s. And ticks will be active this week. So, yeah, Credelio is a wonderful option.
Kimberly in DeForest had asked if it was necessary to give her dog a NexGard the year round.
It's best, because for a couple of reasons, one of which is we have a chart on the wall in our exam room, and I think that last winter there were something like 25 days when it was too cold for ticks to be active. Last winter, we started picking off live ticks the first weekend in February. Yeah. Not to mention the fact that some of the worst, most heinous flea infestations that we find are in the dead of winter, if you can call this a winter.
Yeah. Doug in Waniwak, we'll go to you. Hi, Doug.
How you doing, Larry?
Good. Appreciate the call.
And I talked to you earlier with another veterinarian about my dog who had a really bad phlegmy cough, and it was around the time of the Canadian wildfires. He goes to 2 vets, and I take him regularly. One vet has an X-ray machine, the other one doesn't. Anyways, they both recommended Benadryl, which helps him a lot. Originally, he was put on amoxicillin, and then they dosed it down to doxycycline. But he still coughs from time to time every time he comes from cold to warm. And I was wondering, maybe a third opinion might be needed.
Well, I have a third opinion, or maybe it's more of a question than an opinion. How old is your dog, and approximately what breed is your dog?
He's a rough collie. The X-ray showed he had a growth by his esophagus, but it hasn't. He goes in there regularly to get X-rayed, and it hasn't grown. And he's roughly 10 years old.
Yeah, there's a real possibility that growth next to his esophagus is contributing to that cough. And personally, I have diagnosed those growths next to the esophagus, those growths in the thorax in general, and foolishly issued the owner a gloom and doom prognosis, only for the dog to do great, maybe with a little bit of a cough, maybe with a little bit of exercise intolerance, but those dogs carry on and do well for a good long time. I seriously doubt if more antibiotics are going to be effective. If something so simple as an antihistamine helps fend off the symptoms, then that is fantastic. And another reason, just to flesh some things out here, I completely and totally understand that as a client, as a pet owner, we really want the answer. The challenge is that in order to get the answer, there are certain parts of medicine that the answer is really, really elusive, because in a dog like this, the next level of diagnostic could be a procedure called a bronchoalveolar lavage. And what we do with bronchoalveolar lavage is that we anesthetize those dogs, pass an endotracheal tube, flush several cc's of water into their lungs, recover that water, and submit it for cytology and culture, and et cetera, et cetera. That's a pretty heavy-handed piece of diagnostic that doesn't always lead to a strict cure. So, man, if that dog is living a good life, energetic and active, and a little bit of Benadryl makes them feel better, that might be an excellent option.
Doug, there you go. Thank you for calling. Olivia in Madison, your turn. Hi, Olivia.
Hi. So it's a small world. I've definitely actually contacted your animal behaviorist and might meet with her. But I have a general question. I have an older cat. I think she's about 13, and we do Silencia for her likely arthritis, and she plays a little bit. She's cuddly. I'm just kind of wondering, as cats age, what you recommend for enrichment, and what you recommend for general care, and what you recommend for how long they should actually be left alone, those sorts of things.
Well, cats, I think, to a very large extent, would prefer to be left alone. I mean, you give them food, water, litter, and the remote control, and they're happy for a very long period of time. But enrichment can very much vary according to that cat's physical capabilities. And the Silencia is a tool that has served us really, really well, and a tool that has contributed to older cats' quality of life like no other product we've seen in a good long time. And there has recently been some press with regard to the Silencia and its canine counterpart, Librela, with regard to some potential neurologic side effects. That's a great big conversation all by itself, but we've found precious few side effects and a lot of additional quality of life. So with regard to engagement, 101 ways to engage the cat, whether that be delivering their food, for example, in a treat ball, if they'll still bat a treat ball around, by hiding their food throughout the house, make it a hide and go seek operation to find their food. If they'll still play with a string, the things that we caution people on, like laser pointers, I envision that to be kind of a younger man's game, a younger girl's game. But if you use a laser pointer, be limited, because with regard to the laser pointer, if they chase the red light, that's great, but they never catch anything. It's like going fishing with a naked hook and never getting a bite. So yeah, I love the fact that you're thinking about engaging your aged cat. They don't do crossword puzzles, but they can search for their food.
Yeah, search for their food. And I've got an aging cat who likes it's kind of a plate-sized thing, and it's covered, and there's a ball inside, and Tiger will go over and wrap away on that ball and try and catch up to it and just enjoy it. And there's no batteries required or anything else. It's just the simplest toy is the one that he's used the most.
Yeah, and so often that is the case. And maybe it's a little anthropomorphic on my part, but we have a few people around Lake Mills who will put their cat in a stroller. And there are strollers out there that are cat carriers where the cats are secure. Man, if I was a cat cooped up in the house all the time and somebody wanted to take me for a stroll, I'd think that was the greatest thing ever. Other things that you can do, like patios, and tunnels where they have exposure to the outside, and especially if you have a bird feeder outside. So, man, sometimes they really get fired up over watching the birds outside.
Yeah. Mine likes them on TV, too.
Yeah, I've heard that.
One of the cats, Tiger, can see the TV very well. Particularly likes watching golf. I think because they often have a lot of bird songs.
And the soothing voices of the commentators. Those guys are really good.
Yeah, Jim Nance is pretty good. Well, there you go, Olivia. Cheryl in Hillsboro, your turn. Hi, Cheryl.
Hi, thank you so much for taking my call. I've been concerned about my golden doodle male. He's 4 years old now, and he's been a real healthy guy all along. But a week ago, he jumped up from a sound sleep, and he looked confused and couldn't keep his balance. It seemed like it was more his right rear leg that was the issue. He was trying to walk, and he just was staggering. It only lasted a couple minutes. He didn't seem like he was in pain. It just seemed more like he couldn't keep his balance. And then that same day, 2 hours later, the same thing happened. And 2 hours later from that, it happened. So it happened 3 times that day. It hasn't happened since. I got a little video of it and had sent it to my vet because they just asked for that. And he thought it was a mild seizure. But I also was reading online and read there was things with muscle spasms in dogs' hind legs that kind of sounded like it. And I also thought back how the last couple of months he has not wanted to jump up on the couch or up on my lap. He's 39 pounds, but he's my lap dog. He jumps up there and likes to sit on my lap, every day. He has not wanted to. He doesn't really want to go up steps, but he will. He acts like he's scared to go up now, and that happened prior to this episode. So it made me wonder if it's something more with joints or if it could be 2 separate issues. I was wondering what you would think, and I sure appreciate your help with it.
Well, Cheryl, first of all, what I think is you are really, really observant and really, really dialed in and getting some most excellent care, because sometimes we're lumpers and sometimes we're splitters. Sometimes we try and put things together into one condition, and sometimes they're actually two different conditions. So everything you did with regard to the neurologic episode is spot on. You monitored how long it lasted, how frequently it took place, how long it took your dog to recover, and I assume that you're keeping track of that, and also to take a video and send that to your veterinarian. In which case, it should be pretty easy to determine if this is a neurologic event, such as a seizure, because those dogs are oftentimes ataxic, falling to one side, confused, don't necessarily respond to normal stimuli. And a very crucial component of that is it's episodic, in which case there's an onset and then there's a resolution. And that really makes us, that's pretty unique to neurologic situations. And as god awful and as unsettling as that is, it's encouraging because it sounds like this is a version that, if needed, you should be able to manage it pretty well with medication. There's a real possibility when you talk about a 4-year-old golden doodle hesitant to jump up on your lap or go up the stairs, that there's also some arthritis in his hips or in his back that could very well be worth some x-rays, some radiographs to get an idea of what's going on there.
Yeah, there you go, Sherry. Thank you very much for calling. And Catherine in Wausau, your turn. Hi, Catherine.
Hello, great guest, Larry. And I have a kitty that loved to watch the Olympics on TV. So there's 2 of them.
Good.
And I have an 18-year-old cat, and she's been on a science diet for urinary problems. And now she doesn't want to eat those pebbles. So I cut it and mix it with a pate, and many times she'll just eat the pate and leave the others. So I have to kind of work with it. Is there anything that I can do to get him to eat?
Yeah, exactly. Well, first of all, exactly what you're doing, which is that at 18 years of age, in these aging cats, much like aging dogs, I had a 15-year-old dog that we had to say goodbye to recently. And when they get to that point in life, supplementing their food is exactly what we do. I would also add in there that if he has not had a workup, if he hasn't had blood work recently, that could be worth doing just to make sure that there's not a medical underpinnings there. And one of the most common things we find is renal insufficiency. And oftentimes those cats can benefit with some simple subcutaneous fluids periodically. So if we rule out underlying medical issues, then you know what this cat wants to eat, this cat gets.
Catherine, there you go. Thank you for calling. Mike in Madison, your turn. Hi, Mike.
Good afternoon, gentlemen. My previous dog was a massive stick chewer, which was fantastic because I hardly ever had to buy toys. And my current dog hates sticks and loves all the fluffy toys and other chew toys. And I recently stepped on a sharp piece of plastic, and which is not a first, and I'm sure it'll happen again, but it provoked a thought, which was I've been feeding my dog plastics and microplastics for a decade now. And so basically my question is, obviously all these plushy toys that are nylon-based and polyester and nylon stuffing is terribly unhealthy for the dog and the environment. But beyond that, the nylabones and the dental bones that are partial plastic, I'm really concerned about having her chew on these plastic-based dental bones because of the microplastic. Now that I'm aware of how much plastic I've fed my dog for the past decade, I'm really overly worked up about this, and maybe you could share your thoughts.
Well, Mike, I can sense your reservations and your hesitation, and I feel that people have a tendency to carry their concerns with their own health over to their pets. And if you are concerned about plastics and nylon and things like that, and your dog chewing on them, from a physiologic standpoint, from a scientific standpoint, they really should pass through. They really are pretty inert. They're not going to get absorbed, and they're likely to come out the other side very similar to how they went in. But Mike is concerned, in which case, why wouldn't we look for options that are considerably more natural? And we're always weighing risks versus benefits, because other things that they could chew on, bones, are very common. And dogs have been chewing on bones as long as there have been dogs, and there's risks there. Sometimes they may fracture a tooth, but oftentimes the rest of the teeth are in really, really excellent shape. There are other options, things like bully sticks and rawhides, which can be controversial, but we're careful with rawhides, and we just don't recommend unsupervised rawhide chewing. But my short answer would be bully sticks and bones.
There you go, Mike. Thank you so much for calling. And on that note, Dr. Bill, I want to thank you so much for taking time to be with us today. It's really been a pleasure. You always do such a great job. And I will, and our listeners will look forward to your next visit. Thanks, Bill.
Well, you bet. I'm just a little bit disappointed, Larry, because we had a Kanto, Wanawalk, and Wausau. I was waiting for a Kanawawak to call in as well, so we could get all the more of the funky Wisconsin towns.
We'll try for that next time around, Bill. Thank you so much.
You bet.
Dr. Bill Stork, owner and operator of Lake Mills Veterinary Clinic, works with both small and large animals, and he knows a whole lot. Great to have him with us. Coming up, we'll talk about taking care of rabbits and ferrets and hedgehogs. I'm Larry Mealer for WPR News. Well, you might be thinking of getting a rabbit, a ferret, or a hedgehog for a pet because they're unique, and you know what? They're really cute, too. Larry Mealer here for WPR News. Today we're going to talk about keeping rabbits or hedgehogs or ferrets as pets with our guest, Dr. Jennifer Boonstra, with us. She is a veterinarian at the Badger Veterinary Clinic, or hospital, I should say, the Badger Veterinary Hospital in Cambridge, Wisconsin. Dr. Boonstra has a special interest in exotic and avian patients. And as we talk with her, I want to hear from you. Tell us why you decide to get a hedgehog or a ferret or maybe a rabbit as a pet. Maybe you're wondering what kind of food you should be feeding, or maybe there's a health issue you wanted to check in on. Give a call. The number is 800-642-1234. Or you could email us to talk@wpr.org. That's wpr.org. Dr. Boonstra, welcome. Thank you for taking time to be with us today.
Hi there. I'm glad to be here today. Thank you.
How did you get interested in being a vet for exotic and avian animals?
I was working with wildlife rehabilitation before going to vet school, and I also worked as a veterinary technician at a bird and exotic hospital, and that's what drove me to go to vet school to specialize. And then I have worked at several zoos and exotic-only practices.
That's pretty cool. Well, we're it is. We're going to try and focus on rabbits and hedgehogs and ferrets today, and before somebody adopts one of these pets, what should they be considering?
Okay, well, we could start off with rabbits, if that's okay.
That sounds good.
Yeah, so rabbits make really nice pets. They're very personable. They do require a special diet. They'll need a lot of greens, fresh greens, and Timothy hay every day, as well as pellets. They're kind of similar to a horse in the fact that their teeth continually grow, and if they don't have this variety of foods, they can run into dental issues. And if they don't eat even for a day, that becomes an emergency.
Okay. So that's rabbits. What about hedgehogs?
Hedgehogs, they are considered insectivores. They are nocturnal, so if you're planning on, having them out during the day to play with, they will be sleeping most of the day. They can eat a specialty diet made for animals that eat insects, and then you want to supplement their food with mealworms or crickets. They can have some hard-boiled eggs, those type of things. They are solitary animals, so they sometimes can be difficult to try to get used to being socialized. But if you are consistent with it, then they can make really nice pets as well.
Yeah, I'm thinking, somebody who works all day.
Yeah.
That's kind of maybe the perfect pet.
Right. The hedgehog can sleep all day while you're at work.
Well, what about ferrets? I have never had a ferret, but many friends have, and that was a fun animal too.
Yeah, they are very fun. They're very playful. They are considered a true carnivore. They have a very short intestinal tract that doesn't allow them to process carbohydrates the way other animals do. So they do need to be on a special diet for ferrets. They are very playful. They're usually, the majority of them come from a place called Marshall Farms. So when you get them, they'll have a little tattoo in their ear, and then they're usually spayed or neutered at that time before they're put up for sale. So that's kind of nice there, but they still can be a little smelly, just their usual odor that they have to them, so you have to be prepared for that.
I'm wondering, Badger Veterinary Hospital, of course, has the ability to treat small animals. How common are clinics like yours? Would any vet be able to help with an animal like a hedgehog?
It depends. There is, special things that you need to know and have experience with, and just have certain medications and that type of things on hand that they would need. That's different than a dog or cat. The ferrets can get vaccines just like a dog and cat can. The other two, there's no vaccine that they would get.
You mentioned that rabbits, their teeth are constantly growing, and I can remember that from I was a pretty young guy when I had rabbits. We were on the farm, so the hay and so forth was pretty easy for me to get. But how do you make sure that your rabbit's teeth are at a healthy length?
Well, if you bring them in, just like your dog or cat, for an exam every year, I take a close look at their teeth, look if they're starting to form any kind of points that might be causing cuts on the tongue or cheek. We can file those down either while they're awake or if it's more extensive under anesthesia if needed. Some rabbits their teeth are not lined up well when they're born, and then they'll be more prone to chronic dental issues and need regular teeth trimmings.
Yeah. I was trying to remember if I ever gave a rabbit a bath. I don't think I ever, I'm going to be honest with you, I don't think I ever gave my rabbits a bath.
Yeah, they really shouldn't need a bath. They keep themselves pretty clean.
Yeah, I couldn't imagine having to try to do it. Their legs, they like to kick.
Yeah, you have to be very careful handling them because they can break their back pretty easily if they become stressed and
start to, kick around if they're not being held correctly.
Yeah. Are there common illnesses or conditions that rabbits can develop?
The injuries to them are common, or if they stop eating, they develop something called GI stasis. And like I said, that becomes an emergency. Their whole GI system starts to fill with gas. And if they don't get treatment right away, that is something that can be a fatal condition. So the teeth issues and making sure that they have the proper diet so they avoid any kind of GI issues, those are some of the major things, and just being careful, they are fragile when handling them.
Yeah, that I remember very well from my time with them. How do you know, are there signs that, if your rabbit isn't receiving proper nutrition, are there signs that may show up?
You can watch their stool production. If you notice that their little stools are becoming small or less frequent, that can indicate that they're not eating as much as normal. They do have something they develop overnight called cicatrophs, and they ingest those. They're a real sticky type of a fecal material, and that helps with their gut bacteria. So that's important for them. So sometimes you'll notice that that's stuck on their back end. Then there's something wrong, that they're not ingesting those.
How much time should a rabbit be spending outside of the cage?
It should have a good amount of time supervised, or in a play area that doesn't have any kind of electrical cords or anything like that. It's important for them to get exercise, and not just be in their cage. So at least a few hours a day would be ideal, where you can have them out, playing with them and giving them some enrichment, things that they can play with. They like to play with toys just like a dog or cat. So just providing all that for them.
Yeah. And I'm wondering, I had a pair of rabbits. What about the social life of a rabbit? Should they be bought in pairs?
They definitely like to have a companion if that's something that you're able to do. That way, if they have a playmate that they can play with, just want to make sure if they're male and a female that you have one of them spayed or neutered so that you don't end up with a bunch of rabbits.
Yes. Well, let's turn to hedgehogs for a minute. We've been spending a lot of time with rabbits. I want to know more about hedgehogs. Hedgehogs, they're not as social, I think you were saying, as rabbits.
Right.
How do you, how much interacting can you do or should you do to sort of bring the hedgehog around?
If you get them when they're very young and just get them very used to you handling them, they do have poor eyesight, so you don't want to startle them accidentally. Just get them used to you, used to how you're, their touch. They are, very prickly to hold. They can curl up into a ball when they're scared. So sometimes they can be difficult to handle that way if you're not wearing some kind of gloves until they unroll out of their ball. But if they're well socialized, they'll let you hold them and everything just fine.
And I'm wondering about how long does a hedgehog typically live?
About 5 years is about average. Okay.
And in terms of veterinary care, if I got one, what, should I be taking it regularly to somebody like you?
Yes, definitely. They, because they are, shorter lived, if they do develop problems, that's going to show up when they're younger. They can develop cancer in their bowels. They can have dental problems. They can develop cancers other places, reproductive cancers. They can develop heart disease. So it's very good to catch those type of things early.
Yeah, I would think so. And grooming and hygiene. I don't know if you got a hedgehog here. Does it groom itself pretty well, or do you need
Yeah.
to? Yeah.
Yeah, they're pretty, groom themselves well. Sometimes they can develop, they can get mites. That is a condition where if you're noticing that they're losing some quills or their skin becomes real flaky looking, that would be another thing to have checked out if it seems that their quills are not in good condition or their skin is looking really flaky, that they might have some underlying condition going on. But otherwise, they're very, very clean animals.
And how much space should you be providing for their cage and so forth?
You want to make sure that they have a good-sized cage that they can walk around in, places to hide. You want to make sure that the temperature is good. Anything above 68 degrees, if it gets too cold, they can go into a hibernation state where their body kind of shuts down. So we want to make sure they're staying nice and warm. But a good-sized cage that they can walk around and have some things to play with and interact with in there is good.
Yeah, I was
Sometimes
wondering
they can
about.
have
I'm sorry.
A wheel for extra. Yeah, sometimes they can use a little wheel, like a hamster type of a wheel, but they'll mostly be active at nighttime.
Yeah. So the wheel. Anything else in the way of?
A hide box, some different things that they can play with or interact with would be good.
And what about picking them up and holding them and putting them on your lap in the evening?
Yeah, if they're used to you handling them, definitely the more interaction you can have with them, the better.
All right. Our guest, Dr. Jennifer Boonstra, veterinarian at the Badger Veterinary Hospital in Cambridge, as we're talking with her about exotic and avian patients. And you can join in as well. The number to call, 800-642-1234. Or you could email us to talk@wpr.org. I'm Larry Mueller for WPR News. Great to have you along today as we take a look at some of the exotic pets that you might have today. We've been looking at hedgehogs. We haven't gotten much to ferrets yet, but we will. And we've talked rabbits. There are others as well. And question, give a call. The number is 800-642-1234. Email to talk@wpr.org. John wanted to know, what do you feed your hedgehog?
They make special diets called insectivore diets, and then you would give that as your main diet and supplement that with some mealworms or some hard-boiled egg or crickets. Fresh water should be available at all times, and that pretty much makes up their main diet.
And how are they okay around kids or with kids?
Yeah, they are. They can be painful with those spines that they have, so that would be the only consideration. But like I said, usually they'll just roll up into a ball if they're frightened, but they can be a little difficult to handle when they do that.
Michael emailed us. Michael sees tenrecs being offered for sale. Tenrecs, they're endemic to Madagascar, and some resemble hedgehogs, but they aren't hedgehogs. Do you know anything about tenrecs and what kind of care they might need?
That would be similar to a hedgehog. They are pretty similar, come from the same type of a family. It's just a pretty much, a different type of a hedgehog.
Okay. Let's turn to ferrets for a little bit now. In adopting or purchasing a ferret, how well do they interact with, say, children?
Oh, ferrets can be very, very good pets. They are very playful. They like to play with toys. You have to be careful, though, that they don't ingest things that they shouldn't and end up with a foreign body. They're very playful, handleable. They can make really good good pets.
And I assume needs, like anything else, some regular veterinary care.
Yes, definitely should be seen. They do have a few diseases that they are prone to when they become about 4 or 5 years old. One is adrenal disease, and one is something called an insulinoma. So it is important that they get regular veterinary care to make sure that there's no signs of either of these developing.
Yeah, I was wondering about internal or external parasites, for example, as preventing perhaps, or what issues there?
They can develop heartworm disease just like dogs. If they're going to be outside, you can use something like the Revolution that goes on dogs or cats. They can get external parasites. But otherwise, they're, generally keep themselves really clean.
Yeah, but they can be smelly.
Yes, definitely. They have an odor to them that you would have to be aware of before you're bringing them into your house.
And is it some way to treat that, or have some help with that?
They will already come neutered, so this is just something that is kind of a trait of theirs, that they do have a little bit of an odor.
Yeah, they imagine they have scent glands, and I imagine it would also be. Would it be healthy for a ferret to be descented? Let me put it that way.
I wouldn't recommend that. In general, it's not something that's done.
Since there is some smell, I assume there could be some bathing involved here with a ferret. How often should you be bathing your ferret?
Unless they really get themselves dirty, they can keep themselves nice and clean. They're constantly cleaning themselves, keeping their food nice and clean. If you did bathe them, would make sure that you keep them in a nice warm area until they're fully dry so they don't get chilled. But in general, they shouldn't need regular bathing.
Cassandra sent us an email. Some rodents choose wires, and are any of these pets likely to chew on wires?
Yes, definitely the rabbits and the ferrets. You want to keep a close eye on your rabbit or have it in an area, that's clear of any type of wires or anything else. They love to chew anything they come in contact with. So that's definitely something that they could do. And then same thing with ferrets. They, like to play with everything. So if they see some wires there, they might want to, try to play with it or chew on it.
Do you have any of these as pets yourself, Dr. Boonstra?
Not currently. I've had rabbits previously, but not right now. I don't have any of these.
And I'm wondering, you're in Cambridge, nice community. I've spent a lot of time in Cambridge over time, but a smaller community. I mean, is there obviously must be some call for you to be performing this kind of work.
Yeah, we actually see quite a few rabbits. We have seen some hedgehogs and a couple ferrets, but I would say the rabbits more than anything else. People seem to have as pets around here.
And tell us, and I'm pretty sure that the Badger Veterinary Hospital does not only work with exotics. Tell us about the hospital.
Oh, yeah, we see dogs and cats every day. In addition to the exotic pets, we see birds. So whatever. I've done some house calls for some goats recently. So pretty much anything that you have will help, happy to try to help you take care of it.
Okay. Kind of an all-purpose facility there.
Yeah.
I had a parakeet for quite a long time. He was great. I loved him. Any tips on parakeets and keeping parakeets?
Just be very careful of, if they have flight in the house, that they don't hurt themselves. A lot of times we see them for injuries, if they're running into a glass window or those type of things. So, but otherwise they're very, pretty easy birds to keep.
Yeah, and they'll, I was trying to remember, they'll live a pretty good length of time, if I'm not mistaken. Mine lived quite a while.
Oh, yeah, they can live quite a while, and a lot of people really like them as pets.
Somebody else just sent an email. How common are exotic animal vets, and why do exotic mammals need regular vet care? We kind of answered that part, but how common are people in your line of work?
Well, it's not real common to have, especially, just there's certain places that will see only exotics. Those are pretty rare. But there's a few around here that will see exotic pets. But generally, normal practice won't see a whole bunch of them.
I think, trying to remember, Lee, if I had taken a break here. We did take a break. Okay. Well, that's good to know. I actually did it, and I've already forgotten that I've done it. Oh my goodness me. Well, it's such a pleasure to talk with you. I mean, are you a busy person over there? Do you have a lot of business?
Oh, yeah. It's myself and another full-time doctor, and then we have a doctor that comes in one day a week. So we keep quite busy over here.
Outstanding. Well, I appreciate very much you taking time to be with us today. It's a lot of fun. And just one other question. We have one other email. The type of bedding that's best for those cages, and how often should the cages be cleaned?
Oh, you want to avoid cedar type shaving in any of the animals' enclosures. They have some oils in there that can be very irritating to their respiratory system. So usually you find a nice paper bedding that you can get. Comes in a big bundle. And that's really good. It's easy to clean. It's very good for any of the exotic pets.
Yeah, I'm cleaning my, my cat areas, at least once a day. How often should their cages be cleaned?
Yeah, once a day if you're noticing. Rabbits can be trained to use a litter box in their cage. Same with ferrets. Just as you would a normal, like a cat litter box.
My rabbits never learned that business.
No?
Where to do their business, unfortunately. So there was more cleaning involved with the rabbit cages.
Oh, I'm sure.
Anything else. Well, Dr. Boonstra, thank you so much for being with us today. I really appreciate it, and appreciate the work you do. It's important work.
Thank you. Yeah, thank you. Thank you for having me on today. I really enjoyed it.
Dr. Jennifer Boonstra, veterinarian at the Badger Veterinary Hospital in Cambridge, and she works, well, even with goats from the sound of it, but also the exotic and avian patients that she has, I'm sure, are happy to see her when, at least the owners are, when they bring their pets in. Great to have her along. Tomorrow on the show, we'll hear the story of 4 women physicians who escaped Nazi Germany during World War II, and then we'll take a look at a new travel guide. Thanks for joining us today. Our producers are Clara Neipert and Joel Patnaud. Our technical directors are Lee Rayburn with us today, and Jeff Robbins. Our executive producer is Jill Nadeau. I'm Larry Mealer. Thank you for listening, and stay with us. Lots more in store here on WPR News.